The Inland Coalition on Aging is putting together the Inland Empire Master Plan for Aging. We've developed our 5 goals, and now we're looking for partners to help us implement the plan, which we hope to launch in June. And so these weekly presentations we've been doing are to provide more information to potential partners on what the goals entail. And we hope to gain more partners through this process. My name is Carmen Estrada. I am the Executive Director of Inland Caregiver Resource Center. I'm also the Treasurer of the Inland Coalition on Aging. And so I'm going to be handing it over to Elizabeth Bogumil, who is our consultant on this project. And she's going to be presenting our information for Goal 5. Go for it, Elizabeth.
Hello, everyone. Thank you for putting your information in the chat. And we're going to loop back at the ends and maybe have a conversation about ways that we think ourselves or each of our agencies can become more involved in the transportation focus. So we can go on to our next slide. For today, we're going to discuss how we got here. So Carmen already provided a little framework. We've developed this master plan for aging, but we're going to contextualize how we've gotten here. And then we'll discuss specifically the framework for implementation related to transportation. And then we'll move on to discuss opportunities for partnership, some ideas surrounding that, and what we're already doing with partners. And then some next steps if y'all are interested in becoming a partner or getting more involved in the MPA process. So we can go on. Wonderful. Thank you for everybody who's came in for putting your information in the chat. So the Master Plan for Aging in the Inland Empire complements the California Master Plan for Aging. The California Master Plan for Aging is a 10-year blueprint for promoting healthy aging and supporting quality of life. It focuses on those who are aging, those who are disabled, and also caregivers. The state project was launched in January 2021 by the Newsom administration under an executive order from them. And there's a whole process for developing the state focus master plan. It has 5 goals. And the aim is to achieve these goals by 2030 to make California a better community for those who are aging and then disabled and those who are caregivers. So the first goal is housing for all ages and stages. The second is health reimagined. The third is inclusion and equity, not isolation. The fourth is caregiving that works. And the fifth is affording aging. And if you notice in the California Master Plan, it doesn't necessarily focus on transportation. However, these goals are broken down in a little more nuance, and some of the elements within the state goals do focus on transportation. And I'll provide some context in a little bit on how we were able to incorporate transportation into our goals and why we incorporated transportation. So we can go on to our next slide. So after the California Master Plan for Aging was created, they also created these local playbooks. And the local playbooks are a guide for local regions within California to build their own master plans. So it could be a city, it could be a county, it could be a coalition of cities and counties, or it could be like a neighborhood community. And so we took that playbook and ran with it um, and decided to develop our own master plan for the Inland Empire, including San Bernardino and Riverside counties. But first, let's talk a little about what a master plan is. So a master plan is a multi-sector approach to transforming our human service systems to meet our needs as we age. What that means is that we're working across sectors. So we're trying to encourage breaking down silos of information and working across the different fields. So we want to collaborate across housing and caregiving and transportation, integrating these topics all together so that we can all collaborate to make the community better for those who are aging, disabled, and providing caregiving. We're also focusing on working in partnership with government, private groups, and then nonprofit sectors. So this isn't just a government-led initiative. This isn't a private sector initiative, and it's not just a nonprofit initiative. It's working across all of these different types of organizations to collaborate and make the community better as a whole. And generally, the master plan for aging, not just the Inland Empire one, but master plans in general, are sometimes called intersector plans for aging, but they can include priorities such as housing, long-term care or long-term services and supports, caregiving, transportation, community safety and livability, legal services, healthcare, financial security. These are some examples. These are not exhaustive. Our master plan, however, does focus on 5 key goals, and I'll cover those in a little bit. And so next, we'll go on and discuss a little bit about why the master plan, not just for the state of California, but why the master plan for the Inland Empire specifically is so important. And the next slide has a picture of California along with some statistics. So by 2060, the population aged 65 and older in Riverside and San Bernardino counties combined is going to increase 682%. It's the highest increase in the state. And so, with that high increase, it's important to become prepared beforehand instead of realizing that it was an issue at hand to prepare for this aging population. And so, that's what the master plan for aging in the Inland Empire is doing. We're focusing on how to make the community better for those who will be in this population in 2060. To do this, we created the Inland Coalition on Aging. And the Inland Coalition on Aging, we renamed. So it's currently Inland Coalition on Aging, but previously it was formed in 2008. And it was the IE-LTSS. What that stands for is IE, Long-Term Services and Supports Coalition. So it was a group of people who met regularly and talked about different types of long-term services and supports that were available within the community and how to advocate for them. And we renamed in 2024 to be more clear and specific in what we're doing. So we're a coalition and we are providing supports for those who are aging. The mission, though, has remained the same. The mission is to improve integrated care and service delivery of long-term services and supports in the Inland Empire. And the vision broadly is a community where older adults, adults with disabilities, and caregivers can age well and be integrated in their community. Our coalition has a board. We have Ben Haggerty from IEHP. We have Anna Swartz from Community Access Center. We have Carmen Estrada, who did the introduction earlier from Inland Caregiver Resource Center. And then we also have representatives from both of the counties. Jamaica Bell is the representative from San Bernardino, Department of Aging and Adult Services. And then we have Jewel Lee, who is the director of the Riverside County Office on Aging. So we make sure to have this integrated across both counties, these efforts. So next, I'll provide a little context for specifically how we got to the Inland Empire Master Plan for Aging. So in January 2022, we received a SCAN Foundation grant, and that grant allowed for the development, the early on development of this master plan. And then in 2023, we were notified that we received the California Department of Aging grant to further develop the IE-MPA implementation plan, so more of an action-focused plan. So in September 20, 2023, we released the recommendations report. The recommendations report was what was funded by SCAN Foundation and was essentially a needs assessment looking across all of the needs of community members from San Bernardino and Riverside counties. We did focus groups, we did an assessment of existing resources, and we compiled this all into a report. If you'd like to see that report, it's available on inlandaging.org. And then in January 2024, we began building off of this California Department of Aging grant that we received. And we're specifically focusing here on implementation and actually building projects to implement and help solve some of these problems that community members are encountering. And in September 2024, we released the implementation plan. So this fall, if you went to the conference in September, we released the framework for the implementation. And we've been working on that with working groups, which I'll talk a little bit more about. But first, we're going to talk about our advisory committee. So when we received the SCAN Foundation grant, we wanted to make sure that we had a clear advisory committee that was helping to inform the process of developing this master plan. We have representatives from San Bernardino and Riverside counties. We have representatives from various public and private sectors. You may recognize some of the names on here. Some of these names also, Tanya and Susan, and Kelly. Some of these individuals participated in our working groups. We had working groups for each of our foci, which I'll talk about in a little bit. And they narrowed down to action items that we can do within our community. And that's part of the implementation plan. So this advisory committee helped guide our needs assessment. And we performed a needs assessment from August 2022 to May 2024. The cutoff was really like May 2023, but we did an additional focus group in May 2024 to better integrate the experiences of those who were disabled within the community. So all together, we spoke with informal caregivers who spoke both English and those who spoke Spanish. We spoke with those who identified as LGBTQIA, African American community members, Hispanic and Latinx community members, veterans, and we also spoke with low income and unhoused populations. And these were done in community listening sessions. They were about an hour and a half long, where we were able to delve quite deeply into these individuals' experiences navigating particular resources available to them. Additionally, we were able to integrate the experiences of those in the local tribal communities. The Soboba Martinez Nation, the Morongo Agua Caliente Nation, the Pachanga Nation, the Cayuya Nation, and the Santa Rosa Nations through the use of surveys. So there are some existing surveys that had similar questions paralleling what we were asking in our listening sessions. And so we were able to use that information and integrate it into the needs assessment as well. Our next slide will give you kind of an overview. Like I said, these were listening sessions or focus groups where we were able to delve into quite a lot of detail of these individuals' experiences, being able to navigate particular resources in the community and learn about how they navigated them and some of the challenges and successes that they faced. From this data, we collected the detailed and in-depth experience of community members on 6 key topics. And the next slide is going to tell us what those topics are. We talked to them about transportation, housing, healthcare, behavioral health and social support, Alzheimer's and all other dementias, and caregiving. And something unique about transportation, remember that it wasn't on the 5 bold goals for the state level master plan for aging, but for our Inland Empire Master Plan for Aging, transportation united across all of these other topics. Um, and it was woven through all of these other discussions. So transportation is very important, not just on its own, but as part of these other topics that we addressed too. So when discussing extending life, it's important to discuss quality of life. We talked with people who are in a rural community that specifically said, we're not dead yet. We want to be able to have access to transportation, even if they're not able to drive, to public transportation, so they can be able to go to plays and sports games and do activities that made them feel alive and engaged in their community. They wanted access to transportation so they could maintain social connections and connections to their social circle, especially as individuals age and their family members pass away. They need to maintain those connections. Additionally, transportation is really important for being able to access necessary resources, food, and healthcare, particularly. If we stay in California, it won't be in this area because it's too difficult with lack of transportation, one individual told us. They lived in a rural area that had a bus stop, and they also had access to medical transportation too. But they were trying to figure out how to access free food. Uh, Being passed out at various resource centers in the community, and no public transit went to these distribution areas for the nutrition. And so they were trying to figure out how to access that, and just they simply weren't able to. Additionally, some people who live in the more rural areas of the county, both counties, were trying to figure out how to downsize their housing so that they could move to the more urban areas of the community so they had better access to healthcare and to caregiving and to basic resources like grocery shopping and that sort of thing because of the transportation issues that they faced and the reliability in transportation, particularly public transit. Additionally, disabled individuals that we spoke with said that they needed to be a legal library to advocate for their rights. This was focusing on transportation, but all other topics too. So overall, even though we're speaking about transportation, people who are not taught that they're going to age, and so they have to have a plan for aging. And part of that plan is a transportation plan. People don't know necessarily when they're not going to be able to drive or if they're going to have their license taken away for health reasons or whatever other reasons. If they're going to be too far away to be able to drive, to be able to access resources and get back on time before the sun sets because their nighttime vision isn't that great, or if they're going to need to be on a public transit route. So all of these elements are very important to consider as one ages. Next, we'll talk a little about those working groups. So we took this data that we compiled together in the needs assessment that I just talked about, and we brought it back to the advisory committee, and people divided into working groups. We have a housing working group, there was a caregiving, Alzheimer's disease, and other dementias working group. There was a behavioral health and social support working group, and we had a transportation working group. So today we're going to be focusing on the transportation working group. And I think actually a few of you here participated in the transportation working group. So awesome. Um, and from those working groups, we were able to narrow down 5 key goals for our Inland Empire Master Plan for Aging. We're focusing on housing as home and healthcare, transportation for all ages, abilities, and regions. Focus on caregiving, Alzheimer's disease, and dementias, age and disability-friendly behavioral health and social support, and safety, respect, and equity as we age. And I just wanted to do a quick plug. If you've already heard and participated maybe in these working groups, or if you've heard this presentation, I want to encourage y'all to attend the Safety, Respect, and Equity presentation that's going to happen in April. The reason why is because we don't necessarily have a working group that focused on that. But off of all of the discussions that we had amongst all of the working groups, safety, respect, and equity was line that connected all of the topics that we're focusing on, including transportation. And we can all participate in that regardless of our areas of focus. So I want to encourage you to attend the Safety, Respect, and Equity Partnership meeting too. But for today, we're going to focus a little more on transportation. And before we jump into that, I'll update you on where we are currently in our master plan planning steps. So in January 2025, we released the draft MPA implementation plan for community comment. And right now, we're in the process of building partnerships for implementation. And I'll talk a little about what those partnerships can look like. And then in June 2025, we're going to have a big release event. It'll be on Zoom. I encourage you all to come for the IE Master Plan for Aging Implementation Plan. Yes, like I said, I encourage you all to come. It'll be at the end of June. And then 2025 through 2028 is when we plan on doing the actual implementation process. So doing these activities or projects or processes to improve the community for those who are aging, disabled, and who are caregivers. So let's talk a little bit about what the goals for transportation look like. And like I said, we're going to focus on transportation in this particular presentation, but if any of the other topics interest you, I encourage you to attend those presentations as well. So presentation is goal 2, transportation for all stages, abilities, and regions. And we have 2 strategies. The first strategy is communications and input, and the second strategy is increased ridership. But what does that mean? Let's jump into it. And first, I will talk about strategy 1, communication and input. So the key objectives for this are to develop an educated and sustainable voice to participate in each county's transportation advisory body. So each county, Riverside and San Bernardino, have their own advisory bodies for transportation. And those bodies sometimes meet, I believe, every other month or sometimes quarterly. And uh, it's called PASTAC and CSTAC. I believe PASTAC is the one for San Bernardino and CSTAC is the one for Riverside counties. They meet regularly. And they're really important because it's an opportunity for those who are in the community and wanting to advocate for those who are aging or disabled or caregivers on particular transportation resources. They can come and advocate during these meetings or communicate their needs. And so that's the key element to developing an educated, sustainable voice at these meetings, having people regularly attend and advocate at them for these populations that we are working with. Second objective is to expand and actively promote and increase participation in transit input and planning opportunities. So Riverside and San Bernardino counties both have area plans for transit. And so figuring out and weaving in ways that we can actively contribute our experiences and knowledge on the topics of those who are aging and disabled and caregivers, but also our expertise topics. I know there's some people here from Kaiser. We have some people here from Valley Restart, from legal aid. So taking your expertise from your area of work and weaving it into contributing to these input on transportation within these counties is really important. Additionally, ensuring public voices inform and influence transportation services. So not just our professional voices, but bringing in the general public to realize, yes, we can contribute our voices and give opinions on our thoughts on the area plan or our experiences at the PASS stack or the C stack and tell people about our experiences using transportation and maybe some challenges or some good things that we are experiencing when we're using public transit. And so that all falls under the umbrella of strategy 1, communications and input. And we have a second strategy, strategy 2. Okay, so we want to go on to strategy 2. There we go. Okay, awesome. So Funding oftentimes is dependent on ridership. And so if there's a decrease in ridership, there can be decreases in funding, and that can make it really hard for transportation to be able to fund the types of routes or the types of access that's needed. And so that's why it's really important to encourage increased ridership. It's also really important to encourage increased ridership because that way people know how to use public transit. If one grew up in New York City and you ride the metro everywhere, you kind of know the routes, you know how to get around the town. But if that's not something that you have an experience with or you've done regularly, it could feel daunting. And so it's important to encourage increased ridership. To community members to learn how to use the transit system, to learn how to navigate it, to learn the places that it can go, and not just to encourage increased funding to transit programs. So we have three objectives here. The first objective is for community-based organizations and aging services to provide and connect clients with the best transportation options to meet their needs. And that may include encouraging them to take public transit to the meetings that you have at your offices, or to even provide a public transit route option on your website or as a trifold or something in your office for those who are thinking about taking public transit to get to your offices. It could also take the form of many other methods for engaging them and encouraging clients to take the transit. But those are two options that come to mind. Additionally, the second objective is to increase consumer confidence in all modes of public transportation. Um, I remember the first time that I live in Los Angeles. I remember the first time I took the metro in Los Angeles. I didn't know how to do it. I took it with a friend. My friend showed me how to do it. And then after that, I took many of my friends and showed them how to use the metro in Los Angeles. And so it could be as easy as encouraging one or two people to be advocates in your community to show people how to use it. It could also be organizing a transportation day out where everybody is figuring out how to get from point A to point B on the transit, the public transit. Um, I think in San Bernardino counties, they had a few groups that either exist or they're going to get going that show community members how to take the transit throughout the county. And so even supporting one of those programs and maybe encouraging people to figure out how to get to your location, office location, at one of those transit guidance walk-alongs or ride-alongs could be useful. And then finally, for Objective C, to increase awareness of public transportation options and discounted fares. So there are discounted fares available to people within certain age ranges. I know for people who are in K through 12, there's discounted fares in San Bernardino counties. And then in both counties, there are discounted fares for people above a particular age. So increasing awareness of what those fares are to promote ridership can also be a useful activity. And so next, we'll talk a little about what potential partnerships could look like. I'm going to take a quick look at the chat, see if there's any questions first. Thank you all for putting your information into the chat. This is great. So potential partnership, these are just ideas. You don't have to stick to what's on here. And feel free if you come up with any ideas that you think may be good for potential partnership, either for somebody else or for your particular agency, throw those in the chat because we're brainstorming ways to partner together today. So ideas for potential partnership, you could partner with SBCTA or RCTC to promote existing mileage reimbursement programs for volunteer drivers and specialized transit programs that exist. Those programs exist. Figure out how to partner together and be able to do that. It could be advocating for aging and disabled individuals and caregivers at PASTAC or CSTAC meetings, and at various transportation hearings, or during the area plan uh, feedback time period. It could be participating in and promoting the county's coordinated public transit human service transportation plan and short-range transit plans, and comprehensive operational analyses, so participating in those elements. It could also be participating in improvement to services with navigation teams, and figuring out how to improve services by showing some challenges that people may face. It could be signing on as a service provider willing to promote public transit to clients, having that trifold in your office saying, this is how you get here if you want to take public transit, or various other ways of promoting it. It also could be applying for funding to support transit activities such as walking, public transit guides, or tutorial groups. And so those are some ideas specific to transportation. I'm going to give you a couple ideas specific to all of the goals in our master plan for aging in the Inland Empire, to kind of give some idea of what's already happening and ways that partnerships are already occurring. So for safety, respect, and equity, goal 5, Rolling Start, is already doing safety presentations in the community. And so we partnered with them to apply for funding, so that they could get a grant to expand their efforts and also distribute emergency supply bags. So that's an example for goal 5. But it illustrates how, with our powers combined, this coalition listed on a grant application can show the grant as being strong because it has community support. We're also working with Justice and Aging and California Long-Term Services and Supports Coalition in finding individuals to share their stories about how medical cuts can impact them. Or Medi-Cal, it auto-corrected. And the ICA and the ICRC are coordinating and sharing these stories and connecting them with media to hold press conferences. And the Inland Coalition on Aging is encouraging people to contact their representatives about Medi-Cal and the Older Americans Act, and to figure out ways to make sure to keep those funded. And that's an example of safety, equity, and respect, goal 5 as well. For caregiving, Alzheimer's disease, and other dementias, our third goal, Inland Caregiver Resource Center is conducting trainings for Riverside IHSS providers, and is also going to begin trainings in San Bernardino and Riverside, in San Bernardino County, sorry, through collaboration with the public authorities. So they're going to expand and collaborate with public authorities to do that for goal 3, focusing on caregiving. Also for goal 3, the Inland Coalition on Aging is going to be presenting at the San Bernardino IHSS Training Summit in April. So that's why partnership is already happening. For goal 2, this is something that's already happening with transportation, so that's kind of cool. PASTAC is creating a user-friendly transportation guide for older adults and those with disabilities. It's being done in response and in collaboration with the IE-MPA's goal on transportation. And so a way that you could get involved is maybe taking that user guide and promoting it on your agency's social media, saying, hey, this user guide exists, or using that user guide and distributing it to your clients that you work with, if they're looking to be able to get to places within your community or to your office. Additionally, if you're in Riverside, it could be going to CSTAC and saying, hey, PASTAC has already done this. Have you considered doing it? And advocating for that. And additionally, some partnership activities can work across more than one goal. And so some of those examples are ICA and ICRC working with the Black Resource Directory and putting on a conference in February called What is Really Going On? There was a panel of speakers. They addressed mental health in the African American community and talked about resources that were available. And so that aligned with goal 5, safety, respect, and equity, and goal 4, which is behavioral health. So some of these actions can work across goals to not be siloed. And so I see some chats Um, awesome. I just want to look through and see. Elizabeth, would you be interested in coming to the PASDAC meeting? Yes, I would love to come to the PASDAC meeting. Please send me the information. I will drop my email in the chat. um, let's see. There's additional information on inlandaging.org if you would like to check it out. Um, oh, okay. Transportation, a collection of transportation resources is something that Jillian's talking about. Wonderful. Okay, I just wanted to check in before we moved on, make sure there were no questions. Next, we can move on to what partnership can look like going forward. So we discussed the ways in which we could potentially partner and what that could look like. So in August, we're looking forward to continuing action groups. And that's why I want to encourage you all to sign up as partners. If you sign up as partners for transportation or any other topic that you're interested in, we can then contact you when we start these action and implementation groups in August and say, come attend the meeting. Let's figure out what we're all doing and how to coordinate our efforts. Let's check in with each other. Um, and so we want to support existing efforts and advocacy and existing projects that are already happening within the community. So this isn't just about creating like a new project. This is about seeing what's already existing and how we can bolster them, how we can make them stronger by collaborating, by increasing those who are participating in the project, if that's important, by spreading the word, and then also by applying for funding too. So if you have a project or idea, or if you have a current project and you're interested in applying for funding, we can collaborate on that. So you can send us an email. And I think, here we have it at the bottom, info@inlandaging.org. You can send that an email over there and we'll reach out to you. And partnerships can strengthen funding proposals. Oftentimes they do because they show a lot of collaboration and that's important for funding. So if that's something that you're interested in, please definitely reach out. As you can see, we've already done that and we've been successful in getting the funding for one project already. I am going to also drop a link in the chat, and that link is for the partnership application. So the first thing that we can do is for next steps for partnership is to sign up as a partner. I dropped a link in the chat. You can just click on the link and sign up as a partner. It doesn't require financial responsibility or any kind of really formal commitment. It's just saying, hey, I'm here and I'd like to participate. Another way that you can participate is to join Inland Coalition on Aging. Carmen dropped a link to our website, inlandaging.org. You can go to that website and it has a stay up to date, join the coalition email form that you can fill out. And hopefully we'll see you at the next couple of our meetings. Also, if you want to attend the master plan release event, this is the way that you receive information and the link to do so. We can also commit to helping out with the IE-MPA implementation. So you can commit to participating in the implementation and promoting the IE-MPA with those in your offices or those you work with. We can do potential follow-up meetings if you want additional information or additional ideas of maybe how we could collaborate. We can arrange another meeting. A one-on-one meeting or whatever works for your team. You can connect us to other potential partners. Maybe you know somebody else in your organization that is working on a project that would be great, a really good match for this. Connect us with them. Or if you've worked with another agency or nonprofit or business in the past, please connect us with them. We'd love to be able to further integrate this community so we can support those who are aging, disabled, and caregiving individuals and make the community better for them. You can attend the launch event. I told you how to do that by signing up on the inlandaging.org. Or if you have a project idea or a grant idea and you want to figure out how we can further collaborate and get a little more information on that, before we start the implementation, or what are we calling, action groups in August, you can send an email to info@inlandaging.org, and we can figure out what that project or grant application or collaboration can look like. So there's many different ways to get involved. Hopefully you're able to click on that link and sign up as a partner, if that interests you. And so before we say goodbye, I wanted to encourage anybody in the chat to unmute themselves as well. And we can talk maybe briefly about ways that we think your agencies could potentially fit with the goals that we discussed, and the objectives.